we have a mandate to get started. So thank you very much, everyone, for joining today. My name is Alan Higgins. I am the Health Equity Network lead. And this is a special occasion for the monthly webinars that we have been putting on, as this is 12 months since we launched the network platform. And it's been a great 12 months. Alison will shortly run through some slides just to show you where we have got to. And then after that, we will have Sir Michael Marmot speaking to us about ambitions for the network and hopes for the future. And then we will move fairly quickly into opening up for discussion. And the way that we run the monthly webinars is to keep them as informal as possible. It's a formal context, of course. But it means if you can keep your screen on so that we can interact visually as well. As Alison mentioned, going on mute is always helpful, so we avoid any background noises. But if you can put your hand up, if you have a point that you wish to make or a question to ask, then please do so. And this is very much about getting perspectives from people on the network. It isn't just about asking questions and getting answers. And if someone says something from a network member and you want to respond to that, then that's entirely valid as well. So please do take that opportunity. I should also mention that the event is being recorded. So if you have some objections to that, if you could let Alison know, we'll manage that too. Otherwise, I think we're good to begin. And I'll hand over to Alison, who's going to run through some slides, taking us back to January 2023 and then how we've progressed from then. Alison, Health Equity Network Coordinator.
Yes. Hi, everyone. If you can see my screen, Alan, will you just let me know?
It's loading, and yes, that's there. Thanks, Alison.
Great. Hi, everyone. I'm the Health Equity Network Coordinator. My name is Alison. You probably received a bunch of emails from me, so it's great to have you all here today. We're going to just start a year ago now with our, we had our beta test group that was about 10 people that Alan and I knew in the field who helped us to kind of kick off the platform launch. And now we're at 1,550 members. So I had this actually updated this morning because we were originally just under 1,550, but as of today, we're over 1,550, which is just absolutely incredible. We're so glad of each and every one of you that has joined the platform and has contributed. Everything that you post on the platform makes a difference in growing this movement for health equity. So as you can see, we've kind of got this steady upward trend that we're hoping to maintain going into the next year. So where in the world are nearly 1,600 members? As you can see from this map on the right, this is the view that you can see via the platform on the People tab. So as you can see, we've got people from all over the globe on the platform, and we are truly amazed at the spread. Obviously we've got most of the people in the UK, but we've got 138 people from across the globe who have joined the platform and have been contributing. And Veronica, who I imagine will be on the call, is the lead on our group for global members. So if you're someone from around the world that hasn't joined that group yet, please be sure to do so. So just on the left here, we see, we've got the majority of people in England, but we've also got great populations in Wales and Scotland. And we're looking to grow our population in Northern Ireland as much as we can. Obviously, Alan, being from Belfast, has a vested interest in this, but it is also important to contribute to the network as a whole. We hope to get more people from each of the countries of the UK, so that it's not just England. But we're really pleased with the turnout that we see across the UK and across the world. So the sectors that our members come from, we've made this little graphic to kind of demonstrate the populations of each. So majority, and this is what we've seen kind of over the years, that is from the NHS, from the voluntary and community sector, and from local government. But we also see great populations from academics and from kind of interdisciplinary or other categories, and then smaller populations from think tanks and businesses and social enterprises. But as this is a collaboration with legal in general, we do hope to grow our populations in social enterprise and business over the course of the next year. So you might be familiar with some of these faces that you see on the screen. Our newly appointed volunteer administrators on the network have been able to contribute at a much higher level in growing some of the groups that we have, those sub-networks of topics that we think people are really interested in. So you might recognize Jill and Lisa and Veronica, as I mentioned, and Faye and Paul, who each kind of help each other to manage some of the smaller networks that we have. If you've not yet taken a look at the groups that we have in the groups tab across the top of your platform page, you'll see that we have nearly 40 kind of sub networks of special interest topics that you can join and kind of start the conversation about topics that you might be particularly interested in. And if you're interested in becoming a volunteer administrator on the platform, do reach out to Alan or myself and we can talk about how we might set that up, because we're always looking for more voices to be involved in this movement for health equity. So you'll also maybe see on the right side of your screen the report from the first annual conference that we held in October of this past year. So in Birmingham this past year, we had nearly 200 people from the network to come to be in person to speak. We had 8 breakout sessions run by members of the network, and it was really an exceptional day. We had such a great experience. We had amazing speakers. Professor Kevin Fenton, who you'll see on the front cover there, was one of our speakers, Sir Michael as well, Professor Bola Owolabi, and Pete Gladwell as well from Legal in General. It was a really great day, and we're looking forward to hosting another conference this year, hopefully expanding the one-day conference, and we hope to see as many of you there this upcoming year as we did last year. So keep your eyes out for information related to the upcoming conference. And I think that's a great kind of summary of our 12-month progress. And it's so great to have everyone here today. So thank you so much for joining.
Thanks very much, Alison. And the conference was rather wonderful. It was great to bring people together and to meet so many people who have been active on the network. And just to mention as well about the membership, it's grown, well beyond the various milestones that we set for ourselves to achieve, and that's fantastic. And the 130 odd people from outside the UK as well, because it is a UK network, and we made it clear that people can join and offer their views. And I couldn't help noticing in the chat that Melanie Hartman posted from Hamburg, and Melanie has been fantastic about posting on the network, and I should have said hello at the beginning to Melanie. So thanks for that, Alison. I'm going to go over to Michael to give us some thoughts about ambitions for the network and hopes for the future around health equity. Michael.
Thank you. I get asked, am I optimistic? I remember Amartya Sen once saying, an optimist believes that the present organization of society is the best that could possibly be, and a pessimist fears that that might very well be the case. It was put to me that the difference, that I'm not an optimist, I'm hopeful. And some of you will have seen, I quoted in a piece in the BMJ, Václav Havel, the first president of post-communist Czechoslovakia, as was. And he said that hope is not a prognostication. It's an orientation of the spirit, an ability to work for something because it is good. And it's not the same as optimism. It's not the conviction that something will turn out well, but certainty that something makes sense regardless of how it turns out. If you think about the context in which our network has been formed and grown amazingly in this first year, the context is adverse. And things in the UK are getting worse. Democracy is under threat globally. It's really a very bad situation. But I venture to suggest if this network is evidence, and certainly the mood at our meeting in Birmingham is relevant evidence, people are hopeful. People are hopeful. And what this network is about is not being ground down by the genuine misery that's being perpetrated upon us, but actually hopeful of making a difference. And that's why we're doing what we're doing. I said to a senior opposition, Labour politician, I quoted Governor Mario Cuomo of New York, and he said, you campaign in poetry, but you govern in prose. And I said, you guys are campaigning in prose. What are you going to do if you get into office? Will we see any poetry or just more prose? And I think what our network is doing is poetry, evidence-based poetry, but it's a hopeful vision for what can happen. Certainly in the work that we've been doing all around England, Wales, now it looks Scotland. I'm hopeful about Northern Ireland. What we get from local places is not a sense of gloom and pessimism. What we get is a sense of hope, of making a difference, of working at the local level, whatever the national context, really to make a difference. I was in Manchester yesterday, and I was inspired by what I saw of working with communities. In Scotland not long ago, similarly, in Belfast, in Wales. It really is inspiring. My hope for this network, and it's the reason we wanted to start the network in the first place, is that we will have this social movement of places around the countries of the United Kingdom, and as Jessica will say in a moment, perhaps beyond, where people are showing that with commitment, as Václav Havel said, with commitment, if doing the right thing, the conviction, not the conviction that something will turn out well, but the certainty that something makes sense, regardless of how it turns out. Because many of us come from a tradition of hard-nosed science and evaluation. We'd quite like to know if it does turn out well, which is another purpose of the network, to share knowledge of what works and indeed of what doesn't work, so we can learn from each other's experience. For me, if I want to engender a spirit of hope, I just have to contemplate our network, this network, and what it's doing. Dare I hope that the hopefulness that comes from this network might start to infect some of our politicians, and they might start to present a hopeful vision for the future, not more dour, restrictive, limited, don't say anything in case you get criticized, but a hope for the future of what a better Britain can look like, what a better Europe can look like, what other countries can learn from what we've been doing. And for all those reasons, I see this network as absolutely vital. Thank you all for the flourishing of the network and what you're doing really to make a difference on the ground. Thank you.
Thanks so much, Michael. That's an excellent start to this discussion. And I've written down, I need to follow up about the certainty that doing something makes sense. That really does ring a bell for me in my work. So I'm going to ask Jessica if you want to add anything to what Michael has been saying. But in the meantime, can I invite people now to put their hands up, and I will come to you if you wish to make a comment or respond to anything that Michael said or pick up any other issues. Thank you. Jessica, anything you want to add?
Yeah, thanks, Alan. Well, like Michael, enormously encouraged. I'm Jessica. I'm the Deputy Director and Michael Director of the Institute for Health Equity. And really, it's been fantastic, this network, and I'm loving seeing all the introductions in the chat now. A huge variety of sectors from all over the country. It's really inspiring, actually, and it's a testament to the commitment people have had to tackling health inequalities, despite, as Michael said, the very bleak national picture. And we've really felt that at the Institute for Health Equity, we are, I think it's fair to say, inundated with requests for advice, support, help. What can local areas do? What can help? I mean, this is a cross-party now, so we have interest from Labour areas, from the Conservative, Green, Lib Dem. We're being contacted, and this is relatively new, and it's from all over the country, so really very encouraging. And we're working with a range of different sectors as well. So relatively new to us is the work we do with businesses. We're working with Barnardo's, a huge community voluntary sector organisation, other public services outside healthcare, but certainly from healthcare, there's been an enormous upsurge in interest in what they can do to tackle health inequalities through action on the social determinants of health. So really, despite national lack of leadership on health inequalities and the damaging policies that we've reported on many times, there's so much happening locally, so it's great, and that's accelerating. And then globally, we're also seeing a big level of interest. We've worked globally, actually almost as much as we have in the UK, and we're seeing lots of countries, individuals, different sectors approaching us globally around health equity, and it would be wonderful, I think, for us to expand this network globally, so that we can respond, we can all share learning and experience and frustrations from the UK with global people who are also trying to make these networks. And while there are global networks on health equity, they have rather a different flavour. They're either for specific workforce, regions, or sectors. So I think there's an opportunity here for this network to do its thing. And I was at WHO in November, and one of the people I was talking to, who's a member of the network, said, "Your network's chaos. We get all these emails from people, different people all the time." And I said, "Yes, isn't it wonderful? This is exactly what we'd hoped. And this is part of it. We don't moderate too strongly. We don't have criteria. We let it go. And we hope that the energy and dynamism really take it forward and build this social movement." And I think that's what we hope to do globally as well when we can. So I just wanted to flag up that we're getting an awful lot of requests globally, and hopefully a global health equity network. Thank you.
Excellent. Thank you very much, Jessica. Right, so the invitation is now for people to make comments, talk about their own experience, ask questions if you wish to do so. So I will pause there and see who wants to go first. Excellent. Helen, would you like to get us underway?
Cool. I'll see if I can be clear. I put questions in the chat just in case I'm not that clear verbally. But yeah, just looking to gather consensus and more further consensus for the work that we do at VCSE Nutriri, which is all about reducing inequalities, but improving access to health, food and movement without centering weight as a health metric. So we've got lots going on. We recently visited the RSM, and it was really good to hear Bola talk about rebuilding trust and how trust is a core determinant of health. And so that gave us that further hook into, okay, trust is being eroded through weight-focused care. You know, we've got up to 2/3 of people who are higher weight not either delaying or not engaging in healthcare or behaviours that bring health. And you know what we're doing at Nutriri, it is really about how we rebuild that trust. So for us, that's through doing training, bias awareness training on weight bias, and providing services that encourage, you know, healthier behaviours without centering weight as a health metric. Really simple idea in my mind. But yeah, so I think just to say hi to the room really, and say we've got a project page over on the network. I've asked the question whether I should convert it into a group. Is there any benefit to doing that? That's the question.
I was wondering whether thumbs up in the chat, Helen, because that sounds like a good idea, and certainly something myself and Alison can follow up with you. And thanks very much for that contribution, talking about erosion of trust and how you build trust again. Very interesting. Thanks for getting us underway. Veronica.
Hi, everyone. I want to reflect on some of the things that have been said both by Helen and Michael and Jessica about the network itself. Mm-hmm. As one of the group coordinators, part of the task was to try and see how we can get people more engaged on the network. So what I'm really interested in to hear from everyone here today is, what do they need from the network? What do they want from the network? And how do we move towards a social movement? So not just the network of learning and sharing experiences, but a network of action, and how that process could happen over the next year. So I just wanted to put that question to everyone.
Great question. How do we actually move into being a network of action? Any thoughts about that? Also, any other comments that people want to pick up? James, go ahead.
Hi, everyone. I'm James Osborne. Really fantastic discussion so far. And I think to Veronica's point, you know, looking for those opportunities to showcase best practice, I think is really important. And to Sir Michael's point, you know, the environment is incredibly difficult at the moment, but where we have been able to drive change and create positive change in a difficult environment, I think being able to share that among ourselves to inspire and to inform will be particularly important going forward.
Thanks very much, Jim. That's a good idea about this being showcasing good practice. There is so much good practice going on. And that's something that the network can certainly do. I'll go to Melanie. Melanie, go ahead.
Hello, everyone. I had to prepare my text and my question for you because of my English. I hope it's okay. Thank you that I can take part at this event. I have a degree in interdisciplinary healthcare and management and come from Hamburg and have a nursing.
I know exactly that you're but what form of content?
Excuse me, somebody needs to go on mute. Thank you. Go ahead, Melanie.
Okay. I'm involved in the healthcare of the Halligen. They are like small islands, but without a dike. And I had a question for you until a few days ago. But then I spoke to a person in a leading position there, and it was about how to move forward with a project to improve health with the support of a majority. But because that's important. And for example, to formulate common goals. And sometimes it's already at a very early stage that different or opposing identities on a personal or institutional level are so far apart, we thought or think. And if you don't find a majority for your project at one level, you may find one at the next higher level we talk about, and the majority becomes a minority. That is, I think, really important because of the relations. I read a lot of the studies from Sir Marmot and others, and that relationships that count, we thought. And that's what I found out in the conversation, and it's logical and explainable, I would say. So perhaps this network, perhaps it can represent a majority at an international level, I would say, to improve health equality. That is my question, or that are my thoughts about.
Excellent, and really good English, Melanie, as well. Thank you for putting the time into that. And there's a really interesting point about building consensus, getting people to agree on something, and building that sense of majority. I suppose in my experience, that's been something that happens fairly slowly over time if you start with initiative, but it almost comes back to that point that Michael was making. If you've got the certainty that something that you're doing makes sense, then you can actually move on and build a majority and hopefully get to the point where it tips into action. I'll invite, we have quite a range of other people ready to speak, and if people want to pick up Melanie's point or any of the other points or make fresh points, absolutely fine with all of that. So I'll go to Arfan next.
Apologies, mine's a new point, just to
That's
throw
okay.
into the range of other points that you've had raised so far. And so my name's Arfan Hussain. I'm part of the Power Communities programme within the NHS West Yorkshire Integrated Care Board, which acts as our VCSE alliance. And I suppose one of the things that we've been reflecting on at the moment is when we talk about health inequalities and how we brought it, actually the will is often quite there, but then we end up quite often with external challenges, whether it's the funding climate that Michael Marmot helpfully articulated. But there's also when the conversations get really hard about how do we hold on to those, how we model our behaviours that we expect around health inequalities. And some of that might end up being conversations about when funding challenges become so difficult within local authority contexts or with individual services, how do we make sure that those conversations happen in partnership with the communities, with the VCSE sector, with Health and Care Partnership, to make those decisions together about what unfortunately might sometimes be disinvestment. I'm wondering if there's examples of where we've had conversations like that take place, that experiences others have had, to actually have those difficult conversations and still have that happen in partnership. Because quite often when funding decisions end up happening, we end up defaulting to, as a budget maker, they'll start making decisions that they'll do in isolation and default into bad behaviours and lose that partnership system way of working. So for me, there's almost a bit of, when we're getting into that space, how do we hold on to that system, partnership ways of working, and to essentially, in some ways, do the least amount of harm possible, recognising that quite often when we're doing reductions in funding, that the unfortunate consequences, and I think everyone knows that, is that they will be causing harm. They're just put in a position of trying to work out what's the least amount of harm they can cause.
I think that's a very challenging position to be in, Arfan, and one that I have had experience of in the past, where making budget reductions is always a challenge to partnership working. I'd be interested to see if anyone wishes to pick that up. I'll go to the next question, and then I'll pause for a moment, Michael, in case there's any points that you want to pick up in response to the questions that we've had so far. Thank you very much, Arfan, for raising that point about the difficulty of partnership working, particularly on that pressured budget environment. The next hand up is someone who comes up on my screen as advisor. So apologies, I don't know your name.
Hiya, hello. Yes, technical difficulties, no camera and no name. I'm Nell, I'm from Citizens Advice Newcastle. I'd like to sort of build off of what both of you said, actually, Melanie and Afran. I'm sure everyone's familiar with Citizen Advice. We provide people with support on benefits, debt, energy advice, etc. And ultimately, we believe what we do is, that's public health. What we're doing is part of the public health service, which people don't really usually see it as, which is why we're in the health network, health equity network. And Afran Hussain was talking about how funding decisions, how we're often left out of funding decisions recently, as I'm sure in many local councils have experienced. The budget cuts to homelessness prevention and massive cuts to the voluntary sector, and we haven't really felt like we've been involved in being able to influence those decisions very much, and we don't really know where to go next. And like what you're saying, Afran, I don't know. We need to sort of come together. I'd be really interested in talking to you afterwards. Actually, how do we build that majority that Melanie was talking about? How do we come together and use what little funding we have in the most efficient way, so that we're all supporting each other a little bit more? That was a little bit garbled, but I hope that makes sense.
It certainly does, Mel. Yes. And that's an excellent point. And we're delighted to have people outside the usually recognised public health sphere being part of the network. So people from CAB absolutely are doing public health work addressing social determinants of health. So great to have your contribution today. And I won't go over the points you raised, but again, following up with Arfan, perhaps with Melanie as well, after the meeting, is exactly what this network is here for. So we will do our best to facilitate that discussion and keep that going. So before I go on to the next speaker, Michael, is there anything that you want to come back on? And apologies, someone else is on mic. If you could go off mic.
Well, in a way, what's animating the network, I mean, Veronica's question is, how do we move from shared learning to the social movement, to a network of action? And what's animating the network is precisely the fact that the national context is so adverse. On Tuesday, the Joseph Rowntree Foundation published their latest poverty report, and they classified poverty as less than 60% median income, deep poverty as less than 50% median income, and very deep poverty as less than 40% median income. The Prime Minister likes to say we've taken children out of absolute poverty. I'm sure he likes to say that. Regrettably, it's not true. That the share of people in poverty, in very deep poverty, less than 40% median income, has grown. And the headline that, following on from the Rowntree report on 2 days ago, was significant proportions of people would need to double their income to get any kind of livable level of income, because they're less than 40% of the median income, and the median income is not very high. And that's the context in which we're operating. And I think, picking up Veronica's question or challenge, given that that's the context, we're trying to do two things, I think. One is, we know that a lot of local areas are really active. I think you mentioned citizens' advice. We've got more than 40 areas acting on the principles of action that we've set out. So they're really active, they're doing things. I mean, it is actual action. So the question is, how do we make this more concerted so that what's happening in these different regions, there is more shared experience as they go along? I mean, that's part of the role of this network. But the second function is to influence the national debate. People on this network, I would say, big generalization, but I would say people on this network are much closer to the real conditions in which people are born, grow, live, work, and age than our politicians in Westminster. And given your experience of what's happening right on the ground, how can we actually influence the national discussion? And I don't mean getting into smoke-filled rooms or whatever you're supposed to do to influence party politics, although that could be part of it. No, I mean influence the national debate, rather than say, oh, no, we won't spend any money in the next parliament or whatever it is. As groups of people, I don't want to do it in some prescriptive, organized way, but groups of people coming out of the network, having real debates about what it means to live at 40% of median income, what it means to live and not be able to heat your home, not be able to feed your children. And having council, today's news that the government's finally recognized that the reason councils are going bust is not because they're mismanaged, it's because they've been starved of money, that the government's going to put some more money into it. Well, we need to be contributing to the national debate. I think that would be part of the network of action, the social movement.
That's great. Thank you very much, Michael, contributing to the national debate. I think there are very strong voices in this network and beyond, and hopefully we can maximise the possibility of doing that through the network. So I'll go back to the questions again. Gus Cairns, would you like to pick up again?
Can you hear me first?
Yes, we can.
Yes, okay. I've been having trouble with my Teams. I am a lived experience expert, as they call it. I am 77. I was diagnosed with autism at 70, and I've been working for the last 20 years in trying to get things done for people in the community, working in the community, working in West Cheshire where I live. I know it's a Michael Marmot's area, West Cheshire, and I'm finding it very hard to get my voice heard by public health, health and wellbeing boards, the local ICB, the local police board, everywhere, but I try and get my voice heard. They just don't want to know. I'm just wondering if there is a lived experience group as part of a network, or it is us that are facing this dilemma with the hospitals and things like that, and how can we have our voice heard if we're not grouped together in groups of people with a loud voice? Thank you. That's all.
That's so helpful, Gus, and thank you so much for making sure your voice is heard this afternoon. No, we don't have a lived experience group, and yes, we will set one up, and we will do that with you, because if we do it on our own, we will not get it right. So we will follow up from this webinar today, Gus, to speak to you again about what that would look like, how that will best function. And we will get that lived experience group in place, and then support you to recruit people to that group as well. Thank you very much for making that contribution. Ellen.
Thank you, Alan. So apologies if I keep my camera off. I'm actually in bed with the flu, but this meeting today was important enough for me to basically dial in, and I'm glad I did. So I'm Deputy Director of Public Health in Kent County Council. And so as part of our work with the integrated care system down there at the very far end, down south, Kent and Medway, we have inequalities, health inequalities, very firmly on our agenda, and it is very firmly a perspective. But what you add is this kind of immense breadth, different partners, people speaking from different directions. And it does indeed instill hope, Michael. So thank you very much for using the words you used. And I heard you speak, I think it's about 18 months, maybe 2 years ago, in one of the London Public Health Forum meetings. And what you said, you talked about illustrating, articulating the truth by using data and evidence. Not more than that. We're just talking about what we see, articulating, the truth. And please help us to do more of that. So I benefited already over the months since I've joined this group, but all the evidence you've sent, and that helps me to articulate that in the clearest possible way to partners locally. So then that is immensely useful for what everybody has said, including making sure decisions are made with equity in mind. Just one additional sentence, and that is, can we also have a more of a focus on the so-called health inclusion groups? So largely groups we don't have a lot of data on. It is there in grey or whatever literature, probably not unpublished. very helpful, very, very happy to support this from my little perspective. There's a lot there, but it's not shared enough. Thank you.
Thank you very much, Alan, especially for making the effort, given your situation. Good idea about the health inclusion groups, but also thank you very much for offering to help us engage with that aspect on the network. We will follow that up with you as well. I will keep moving on. We have a large number of people wishing to speak, so hopefully we can get this through in the next 15 minutes or so. Dagmar.
Hi, hello everybody, and thank you for making this network work. I'm long in the tooth. I used to be a paediatrician and a director of public health. I've now stepped down into honorary and voluntary work, but equity has always been a driving force for my work. So two things. One around hope. I do think as a paediatrician, children and young people have to be a key audience for the network, key members, key players. And for that, I do feel we have to try to have a positive frame. I know that there is a lot of awfulness out there, and we are really, really good in describing the awfulness, and that has its place. But when I speak to young people, actually, they don't just want to see the awfulness, they want to flip it and say, let's muscle in what we can do, knowing what we can't do. So how we can bring into that network the kids, and there's brilliant work all over the place, Kirklees with the democracy schools, and I mean, lots and lots of things to actually really tap into the power of young people. And there's also the planet, we can't forget it. That's one. And then specifically for Sir Michael, obviously we're all sort of the fan club here. I still feel multidisciplinary science, we haven't quite sweated enough. And I am now long in the tooth. Have I actually ever really understood economics? No, I haven't, to be completely honest. I feel we've reached the point, the economic model is so broken. The new economics, WHO is trying it out now, well-being economics and health. That is an area where we need to be stronger. And I'm sure you and all your erudite friends and networks, can we pull them in a bit? And particularly the younger growing consultants and DPHs to be, they need to have it on their fingertips a bit more, because it's a different argument. Yeah, growth, growth and growth. What it's not, that cannot work. So help us with that. I shut up then.
Thank you so much, Dagmar. At least two things there that were of great interest. One, focusing on what can be done, definitely, and also the interest in the economy and health is one of my interests, and certainly I don't have a full understanding there. So let me take that away as something that we need to follow up through the network. Eunice.
Thank you, Adam. Two quick points, if I may. I mean, I do like that idea of the national conversation, because I think that's so important. And just look recently at what a national conversation can look like. Look at the injustice to the sub-postmasters in this country and the television drama that sort of was the sort of catalyst for that conversation. The public is ready to have a conversation about injustice, and they will do something about it given the opportunity. So that's one sort of point I wanted to make. And second point, I mean, this group has just been, it's been excellent and is growing. It's a coalition. I say it's a coalition of the willing. It's a coalition of the determined, because everybody wants to do something. But I'm just interested, which is an issue that came up in one of the forums we host. Sorry, I'm Eunice at National Healthcare Inequalities Improvement Programme at NHS England. And one of the issues that came up very recently was actually a very big thing about data, in that NHS data sets align to the 2011 census and not to the 2021 census. And one outcome of that is that, for example, certain groups, Gypsy Roma traveller groups, are not included in that census, and that has implications and knock-ons elsewhere in terms of excluding some people. And it's just an observation that was being pointed out to us. But how you get all the relevant organisations to shift some of that big stuff and align it, through legislation, through aligning the data sets across all those organisations, because data's come up in the conversation here, is if you've got good data, you can do something about it. It gives you the evidence. And so I just wonder, collectively as this group, but also individually with the organisations in this group, how you can move some of that forward. Where are the key policy strategy levers? Where do you really need to press the flesh, and how do you do it to get action? I'll stop there.
Thanks very much, Eunice, and particularly for pointing out that sense of injustice in your first point there being a crucial thing, because too often the sense is that inequalities in health are accepted as just being a consequence of living, and we want to retain that sense that is injustice. Again, I will leave it for others to pick up the point around the statistics that you mentioned there, but thank you again for making that point. I'll move on quickly. Sue?
Okay, can you hear me?
Yes.
Hi. Just a couple of things. I actually think what Michael is saying about the narrative that we have about opening doors for hope is really important, and it's the key thing that separates the different bits of the third sector. And I'd also like to just talk a wee bit about how I think it's, in terms of the network, it's really important to introduce more to these sorts of events, as well as sort of online smaller groups, because I think there probably are rather a lot of them, and focus on the things that actually are hitting everybody. So we have a situation where I think the public is much more aware of not just if they're in poverty themselves, but actually what other people are feeling, and they want to do something about it. And then actually doing things makes people feel better, and it makes people who are disadvantaged feeling better. Now, I'm the chair of something was called Be But Fastly, is now called Better Places. And I have to say, we've just actually lost our lottery funding, even though almost all the players we work with have acknowledged that our reach into rural inequalities and individuals, and responded to them quite quickly through a plethora of activities, is something that can't, we think we can survive, but it really is part of the problem about where, anyway, I don't want to talk too much about the sort of funding issue, but that's a bit of a problem for at the moment. But our ethos is very much to be enthusing people locally, doing all sorts of activities that make them feel better, rather than individual social prescribing or whatever, and that actually the other services have actually recognized that we are reaching people that they actually had no idea were there. And that's quite important. And one of the big obstacles, because I've been working in this area for quite a long time, I'm a psychologist originally, is we've got an incredible number of very socially motivated staff at the front line, but actually we've still got the public system working in a way that makes the sort of change, both in terms of attitudes to people, the poor, and to do, work collaboratively. And I think it's one of the good things that we could do based on the work that the Marmot team have been doing, is based on the Marmot cities, and to introduce how those principles have actually helped people who are actually involved in strategic planning, encouraging different services, not just to talk to each other, but to appreciate the assets in communities. And I think that's something that would also make the realities of the movement something that was embracing a lot of the people who are probably part of it, but don't necessarily know or aren't close enough to how what are the levers of change. One of the things I'm doing at the moment is actually writing something on what are the accelerators locally of more sustainable local communities, more respect for a new settlement with communities between public services. Is that there are things that we can recognise now that really make a difference: social enterprise, social movements, and progressive leadership, and to have some things that stimulate that sort of debate on change, I think would be quite useful.
Thank you very much, Sue. I note the points that you've raised, which are very helpful. And with the remaining time we've got, I'm going to prioritise people who haven't spoke already. So Helen and Gus, I will come to that at the end if we have time. But I'll go next to Cha Swan, and apologies for mispronouncing your name, no doubt. I can't quite hear you. Try coming off mute again. Sorry, I think there's some problems there. I'm going to suggest if you could put something in the chat, or I'll come back to you again in a moment if you want to try rejoining, because it would be great to hear from you. I'll move on and come back to you again in a moment. James Buckley.
Hello, everyone. I'm James Buckley, and I grew up in the East Midlands, in a little town called Boston, that on the index of multiple deprivation scale is on the deprived end, and I'm acutely aware of how perhaps my different trajectory would have been through differences in my upbringing and my education. I was very lucky to be able to study Masters in Global Public Health at UCL under Michael Marmot, so lovely to be here. My question is twofold. One thing is, I hear a lot of these conversations about how we're doing some fantastic work in regions and local areas, but often we don't have both the spread or sustainability of these interventions. Once these interventions run out of funding, it kind of vanishes almost into a puff of smoke, and this evaluation of these interventions is often not carried in and spread nationally. This brings me on to my second point, where I work for a company called IQVIA, and we do real-world evidence and healthcare resource utilization studies on health economics. But we very much traditionally focus on the burden of the healthcare system, focused in the secondary care and hospitals, right? We're hearing a lot of stuff on the call today from Dagmar and Sue about the importance of well-being economics and the levers that we can act upon, especially the value of the third sector and the community interventions. My point and question to the group is, how can we change the lens in which we view these interventions so that we evaluate them in a better light, rather than the kind of very narrow focus that we traditionally have? How do we bring the social value into a world that is very quantified? So thank you for the time today.
Excellent. That's a great point, James. I won't respond directly to that one. And I'm just going to say that because we have 4 minutes left, I'm afraid we're not going to be able to get to most of the people whose hands are raised. But before I come back to Michael and to Pete Gladwell, I will go back to Cha Swan again, see if we've got through. How's that? Oh, I'm sorry, still can't hear you. Oh. I'm sorry, Cha Swan, the tech has defeated us today. Next time, we will give you a priority. And again, if you wish to make comments in the chat, please do so. I'm aware that people have been putting questions through another format. David Buck, thanks for the question, and Tammy as well. And we will come back to those after the webinar. Thank you very much. So Michael, and then Pete Gladwell, and then I'll have a final say just to close the meeting. Michael.
Well, I just want to pick up a couple of things. I've heard twice now in 2 days from Dagmar today and yesterday from somebody in Manchester about hearing the voice of young people. I think that's a wonderful idea, that we should encourage, find a way to capture the voices of young people to speak out Dagmar said she's young in the tooth. I think of Dagmar as being the future, a young activist in public health. So I'm feeling a bit shattered if she's long in the tooth. What am I? But capturing the voices of young people. The second thing, I was asked to speak at a meeting of the Health Devolution Commission in Parliament. The co-chair said to me at the beginning, "Are you going to be disruptive as usual?" And I said, "I'm going to tell the truth." So just thank you, Alan, for bringing that up. But that's what we bring to this. We bring the truth of lived experience, the truth of the data, the evidence. We bring the truth to this debate. And forgive this personal note at the end, but I think it did give me a spirit of hope. At this Health Devolution Commission, Andrew Gwynn MP, who's the Shadow Minister for Social Care, said the next Labour government will make England a marmot country. We will take action on the social determinants of health. We need to hold them to it. We need 1,500 people plus in this network to hold them to it. We want them taking action on the social determinants of health and creating greater health equity. Thank you.
Thank you very much, Michael. That's a very welcome point in which to conclude. But before we do, a very important partner for us in the Health Equity Network is Legal & General. And I'm going to invite Pete Gladwell to introduce himself, Pete, and just to give us some closing words, and then I'll round up at the end.
Thanks so much, Alan. And yeah, just wanted to say a big thank you to everyone who's already contributed. I mean, the vision for this network was always that we wanted to connect people who are just doing fantastic work around the country with, Sir Michael and Jessica and Alan, and Alison and people who can really share that knowledge and also hopefully enable people to just develop and improve their places through working together. So it's just been fantastic just to listen and learn, to be honest, as you've shared kind of tips and encouragement with one another. So yeah, I mean, for what it's worth, the only thing I would add is, people like Legal & General are stewarding your money, and so it's really important that you continue to hold business to account. We large amounts of your pensions, for example, or savings will be with people like L&G. So I hope it's not too odd that we're here, because really this is exactly where business should be, as part of supporting these solutions, whether it's Legal & General or other businesses in future. But yeah, really great to join you, and I've really appreciated some of the people just sharing about how helpful the network has been, and we'll pick that up with you in future. So thanks so much, and I'll hand back to you, Alan.
Brilliant. Thanks very much, Pete. Great point. This is exactly where business should be. Excellent point. So thanks very much, everyone. I am so heartened by the contributions we've had today. Apologies that we didn't manage to get round to everybody, but we hope to see you on future webinars on the network. And my final word is that it's 1 year since we launched, so we're only getting started. Thanks very much.